Hi, I'm Amy Mahaly with Be Well Clinic, and this is our first in our Gentle Detox Method series. Today we are going to talk about detox baths. This is a phrase I use so often, I forget other people don't know what I mean. So a detox bath is taking a bath in a dechlorinated bath, preferably, that has either apple cider vinegar, Epsom salt, baking soda, and then kind of an advanced bath would be seaweed or bentonite clay. Taking a bath in these substances will pull toxins through your skin pores and get them out of the circulation without them having to go through the liver or the kidneys through stool or urine. The amount of surface area you have under the water matters. So more surface area, more detoxification. If you do not have a bathtub, do not like baths, cannot get the person to take a bath, you can do a foot soak, but again, it's about surface area, so it will be helpful, but not as helpful as a bath would be. When you are doing a detox bath, this is actually one of those things that can become cellular detox if you are in a bath too long, you make the water too hot, or you put in too much of the detox agent. So the detox agent is the things like apple cider vinegar or Epsom salt. In general, we do about half a cup to 1 cup in each bath that we do per person. And if you're a child or a small baby with less water, of course, you would do less amount. This amount of detox agent is often very well tolerated, but you may find that you need to start with 5 or 10 minutes in a bath and work up to 20 or 30. Some people enjoy longer baths, but really getting that 20-minute mark is where a lot of the detoxification happens, and you are in a good place of feeling cleaner. If during your bath you are feeling headache, racing heart, flushed suddenly, maybe a little nauseous, you have just initiated a little cellular detox. It is okay. Sometimes it happens. We just get out of the bath, rinse off, cool off, drink a lot of water, and usually those symptoms resolve within a few minutes. And now you know, ooh, that was a little too much for me, and you need to just slow down and work up to that over a little more time. The other question I get about detox baths is, can I put multiple of my children in a bath at the same time? My answer to this is it depends. We can share toxins back and forth. So what one person releases, the other person could absorb. So what I tell people is, if you're detoxing for maintenance, everyone's doing well, there's not a lot of toxin symptoms, you're just doing it to stay on top of detoxing, then you're probably good to put everybody in together. If some child is needing to be cleansed for sure because of symptoms, they should do a bath by themselves so that we're not sharing with anyone else. The last thing with that is that our bodies will tell us which detox agent we want to put into the bath. So you may want apple cider vinegar for weeks in a row, and then suddenly your body needs the magnesium, and it will ask you to put magnesium in the bath instead of apple cider vinegar. So before you draw a bath, ask yourself or your child, what should we put in the bath? And then put that agent into the tub with your body, and it's going to be the best one for your body on that day. If you are dechlorinating your water, you can take a detox bath every single day. And sometimes 2 or 3 times a day can be very helpful if we have more significant symptoms, more severe symptoms, or symptoms that are resolving when you're in the bath but then come back through the day. Just get in a bath again. In general, we can do about 3 baths before we start getting dehydrated. You can do more baths, just make sure you're watching the hydration status and listen to your body. That wraps up our video on detox baths. If you are enjoying the series, make sure to subscribe and hit the notification bell so you can get our next in the series, which will be on oil pulling. See you next Monday.